the REBT Advocates, number 9, with Dr. Michael R. Adelstein and me, Tommy Bateman. Let's get started. Michael, thanks for joining to talk about motivational interviewing and REBT today. We're bringing it up because, it's another popular counseling technique for those that are resistant to change. I know we've encountered this, and it's starting to be big in smart recovery. I know I've been trained on it for those, adolescents and kids, and now with jail clients and court-ordered clients that really don't want to come in and do therapy at all, and that's what motivational interviewing is there, purportedly there to help with. What's been your experience?
Well, normally I find that just using direct REBT tends to be more efficient, and I think we'll be going through some points and be more specific about it. So I generally don't think in terms of motivational interviewing or go through the various points. I find that teaching the REBT principles and then how to apply it to addictions is the most efficient method, more efficient than the motivational interviewing overall.
Absolutely, and I agree. I think what we're going to do today is go through seven points that some folks have said are the spirit of motivational interviewing. So let's get started with the first one. Why don't you address it?
Okay, well, the first one is motivation to change is elicited from the client and is not imposed from outside forces.
Mm-hmm.
And so what's your response to that, Tommy?
Well, yeah, as you and I were discussing earlier, while certainly there are influence on someone's person's life, the example we used was a man is desiring to stop drinking, not because he has a problem with drinking. He doesn't mind his drinking, doesn't have a necessarily bad experience with it. In fact, he likes his drinking, but his wife does not. And in this case, she's influencing him to change his behavior so that they can have a good relationship, or for whatever reason. But in this case, the motivation for change is coming from him, just influenced from an outside source. But the motivation is, I want to change my behavior not because I dislike the behavior, but it's because I prefer a good relationship with my wife over this particular behavior.
Yeah, that's a good point. And it's particularly interesting with couples, so I'm glad you brought up couples, because sometimes I'll have a client who'll say, well, I'm not going to change just because my wife wants me to change. I want to change for myself. And as you're saying, if he decides to change to make his wife happy, he's really doing it for himself, because he's really saying if his wife is happier, then he's happier. If his wife was happier and he was less happy, then the calculus would be not to stop his drinking. But if he's going to be happier, he's doing it for himself, and he doesn't have to think he's being controlled by his wife. But as you're saying, he's being influenced by his wife. But there are all kinds of influences that lead us to do things, or at least are part of our decision. And if we're not going to do something because there are outside influences in the mix, then we wouldn't do anything.
Exactly, and that's the point. You can lead a horse to water, but not make them drink, and that's kind of what we're experiencing with a lot of these court-ordered or kids forced into therapy with by their parents. If they don't see in their personal economic calculus that change is worth it, they're not going to do it. So it's our job to perhaps show them ways to which they can satisfy the court or their parents in a way by changing behavior. But I don't see any other way to get around that.
I agree, totally.
So the second one is, it is the client's task, not the counselor's, to articulate and resolve the client's ambivalence. What is your response?
Well, the reason someone comes to a counselor is because and pays them is because the counselor is seen as the expert. So largely it's up to the counselor to teach the client concepts, methods, and tools to use to overcome the addictive behavior. And then it's up to the client or addicted individual to implement that. But I think what we do want to emphasize and get away from is the idea of non-directive counseling that a lot of therapists use in part, that you lead the client to the answer. You don't want to give them the answer. You want to lead it to them, uh, because then it'll be have more of an impact. But I don't think that's necessarily the case. I think that when you give clients answers that make sense to them, then that's a lot of incentive for them to try to implement it to make their life better.
Well, I think the common retort would be, well, we need relationship, relationship, relationship in the counseling practice in order to motivate a person to change or even believe what you have to say to begin with.
Well, often the relationship does help, but you don't need it. It's not necessary. There are people who change their behavior dramatically and their emotions from watching YouTube talks, reading books and articles with no relationship to any counselor at all. So obviously, a relationship isn't necessary. Or even someone who comes to a teacher and learns how to change certain behaviors and doesn't necessarily like the teacher or feel bonded to the teacher or have a relationship with the teacher, but they still change. So I think often a good relationship is a positive, but not always and not necessary.
Yeah, I think the common thing is if you walk into the doctor's office and you don't really know the doctor, but he says, "Here, take this. This will cure your ailment." I don't think my negative or positive relationship will have an impact on whether or not I take that thing that could cure my ailment.
Yeah, usually not. Some people might put too much emphasis, of the way I see it, too
Hmm.
much emphasis on the relationship. But the bottom line is it's their choice. But they're relying on the expert
Hmm.
outside of the relationship to change. So it's really not a necessary condition.
Absolutely. How about this third point that just grates me a little bit? Direct persuasion is not an effective method for resolving ambivalence. So, in other words, persuading somebody, showing somebody the reasons why this is a better choice to change or to use this method of to use this method of change. Persuasion is not the way to go to resolve the ambivalence between, oh, should I change or should I stay the same? I don't know, but I can't give them facts. I can't show them empirical evidence or logical evidence that this is possibly the way to change. That would that would be counterproductive. I don't understand that point at all.
Yeah. Do you have? I agree with you totally there, Tommy. And do you have any idea what motivates this sort of non-directive approach? Is it that the devisers of this tend to be non-directive counselors and they believe in that, so that's what they're pushing here?
Well, the times I've been trained on it and the culture in which it's been really promoted has been a very Rogerian, as in Carl Rogers, one of the kind of a counselor from the last century. He's non-directive, he's person-centered, and I think that's just kind of a culture of the mental health world. But again, we learn these techniques and we learn these philosophies and interventions in order to use them. Don't persuade people. Tell that to any salesperson that's ever made a sale. They that's what they do. They take someone who's either resistant to or ambivalent about buying something, persuade them using facts and evidence, and get the person and better that person's life that and through that method. So why is it any different for counseling?
Exactly right. The next one is along the same lines. The counseling style is generally quiet and elicits information from the client, and I think our previous criticisms apply directly to this. And another point here is something we've mentioned in previous podcasts, and that is our approach to therapy, rational motive behavior therapy, is based on an educational model.
That's
We
right.
teach the clients methods and concepts and tools they can use, and not a therapeutic model. And as you're saying, the therapeutic model often has a good dose of non-directive counseling, which we don't care for at all.
Absolutely not. Absolutely not. I think when I wrote you about this, my one response to that was just yuck.
Right.
The fifth point: the counselor is directive in that they help the client examine and resolve ambivalence, and that's all we're going to focus on. And this is where I think motivational interviewing begins to fail. It doesn't treat. It only gets people to treatment. In fact, a lot of the articles you can read is how motivational interviewing can help cardiology patients or HIV patients to engage in the practices that will help their physical health. But the thing is, that's not the treatment. It's just motivating them to do the treatment. Again, REBT is much more efficient, in which it's showing that, all right, you want to be better in this way. Well, this is how you do it.
Uh, well, actually, I think I have a different perspective on this, and that is the first part of this is the counselor's directive, and we agree
Yes.
with that.
Yes.
I like that, and it seems like a total change of pace in what they've been saying before, which was largely non-directive, and they help the client to examine and resolve ambivalence. Well, that's one of the things that I do as an RBT therapist. I
Mm-hmm.
help the client examine and resolve ambivalence, and one of the ways I do it is by showing clients how to identify their irrational thinking and change that, and then helps them resolve ambivalence.
Sure.
And that's a way to examine it also. And I have other strategies such as listing the costs of drinking and reading that vividly and things like that. So
Yeah.
I'm pretty much in line with this, unless you see some things in it that I don't see.
Oh, and I think the quibble I'm having is their only directive. I think the point they're trying to make is their only directive in that they help resolve ambivalence, but they don't show them any therapeutic change. Just ambivalence is gone. So now what? That's my quibble. Whereas, as you said, you help resolve the ambivalence, true, but then added on top of that, we have the REBT interventions.
Right, and it may not only be on top of it, but it could be as part and parcel of helping them resolve the ambivalence.
Absolutely, and we're on the same page with that.
Yeah, right.
So,
But it is kind of strange that all of a sudden they like being directive.
well, I mean, the goal of motivational interviewing is to get people to resolve ambivalence, and if that's their goal, then I think they're suddenly realizing, hey, if we're trying to resolve ambivalence, we need to get directive about it. Well,
Right,
how about
exactly.
resolving anxiety, depression, and all other disturbing behaviors and emotions? Let's get directive about that too.
Yeah, yeah. Well, they're seeing the light.
Yes, they're getting there. Point
Right.
number 6: readiness to change is not a trait of the client, but a fluctuating result of an interpersonal interaction. That's strange to me. This abstract concept, this abstract object called interpersonal interaction, has a human trait called readiness. This makes no sense to me. What was your reaction to that?
Well, normally the reason someone asks for help indicates that they're ready to change.
Sure.
So I'm not so sure about the readiness to change idea. And sometimes clients are ready to change. They want help, but they're not changing. So then we help them change. So this idea in motivational interviewing might be assuming that if someone says, I want help, but they're not changing, that shows they're not ready.
Mm-hmm.
But I haven't seen that in my practice, that they're not ready. As you're saying, they don't know how to change, and it's our job to show them how to change. That's why they're not changing, not because they're not ready.
Exactly. And if we ever found resistance, well, we would try to say, well, what is a goal you have in life? Oh, my goal is to have a better relationship with my kids. Oh, well, excellent. I can show you ways to not only help with that, but ways in which you could resolve the reason you had to come here to begin with. Whether you're here on a court order or your parents made you, I could certainly, not only help you with the goal of getting the court or your parents off your back, but we can also help with your kids and your ultimate goal of having a better relationship with them.
Yeah, I certainly think that would be persuasive
Yeah.
with some clients.
Yes, indeed. So, last point: the therapeutic relationship in motivational interviewing resembles a partnership or companionship. What's the REBT version of a therapeutic relationship? Is there one?
Well, yes, a therapeutic relationship is a relationship between a therapist and a client. The fact that there's a therapist there makes it therapeutic,
Mm-hmm.
and the fact that the client shows up means they have some kind of relationship, good, bad, or otherwise. So hopefully, it's more of a partnership in the sense that the client is on board to getting help from the therapist in a constructive way and working on things. Um, so this seems sort of self-evident to me. Although if they're saying if what they mean by partnership is an equal partnership, then I would disagree because the therapist is the expert.
Mm-hmm.
So that's not equal. And then the client normally is paying for it. So the client is the financial end, the therapist is the educational end, and then the client getting help is the result of the two coming together.
And I do think this has to do with the cultural aspect, the culture of the mental health world that I mentioned earlier. Is they are afraid of an imbalanced power differential there, in which the therapist is able to have some sort of power and some sort of pernicious influence over the client, and therefore they need to humble themselves and put themselves down. Less than expert and regard the client as a co-expert, if you will.
Yeah, that's a very interesting point you bring up, and I think there's a lot to be said about that, the power relationships in therapy, and a lot of people have said things about it. Often I disagree with them about it,
Mm-hmm.
so perhaps we can discuss this in a future podcast.
I think that would be an excellent one because there's so much to unpack there.
Okay, very good. Well, thanks for going through this with me and shedding the light on motivational interviewing.
Thank you for your expertise. I need it.